Welcome, everyone. My name is Rhonda Fisher, and I am the Clinical Program Lead for the AHA Team Training Program. And we want to welcome you to our March webinar on the fundamentals of strategic planning and successful TeamSTEPPS implementation. So we are pleased and so privileged, really, to have Matt Kelly and Adam Colris from Tank, one of AHA Team Training's strategic partners. They've been with us before. They're back with us today. You are in for a super treat. This is going to be a fantastic presentation for you today. Matt and Adam, the information they share is just as practical as it is engaging. So you're in for a real treat today. But before I hand it off to our speakers, I'm going to go over some rules of engagement and some announcements. So you can access audio today by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. Please do note that you're going to be in a listen-only mode throughout the presentation today. I'm going to be moderating a Q&A session at the end with our speakers. So if you have a question, please chat those in throughout the presentation. If it's technical or logistical, we'll answer that right away for you. If it's a question that you have for our speakers, we'll wait and save that for the end. Please also note that today's presentation is being recorded, and we will notify all registrants when the recording is up on our website. We're happy to offer CE credits. Yay! In order to claim your CE credit, however, you do need to have a Duke OneLink account. This is a one-time only setup. My colleague Kara is chatting in those instructions. You can also refer to the email that was sent to you this morning with the attachment. The important part, after making sure you've got that Duke OneLink account, this is the important part for getting CE credit for this webinar. You're going to want to, following the webinar, text that TUXFET, that little code number that you see on the screen. And don't worry if you're missing it now, we're going to share that at the end too, but you will need that to secure your CE credits for this particular webinar. So moving on, I want to tell you about some upcoming team training events. We're super excited. We have a Master Trainer information session coming up on April 4th. That's brand new for us. And really what we've heard from the field is they really want some more guidance on who should be coming to the Master Trainer courses. What is their role? What's a Master Trainer anyway? And what should their role be in their implementation? Or how do we set our implementations up for success in the first place? So we're going to offer, it's kind of an office hour kind of structure where we're going to give you some insightful advice on selecting the right candidates for the role of Master Trainer. We'll give you some pre-course strategies to assess, make sure your team is fully prepared and set up for success. We'll overview some of the innovations made to the TeamSTEPPS curriculum, including highlight again our friends from Tank and our wonderful human-centered design exercise component, and then do a Q&A with any of you that are current Master Trainers or hopefuls to be a Master Trainer. So again, this is our first one of these. It's absolutely free, and we hope that you will join us if you're considering TeamSTEPPS or how to get more Master Trainers up and rolling. So you'll also see a list there of in-person TeamSTEPPS Master Training courses. We are pleased to offer Master Trainer courses all over the nation. They do fill up fast, so you're going to want to hop on and get those spring registrations happening if that's the time frame that you're hopeful for. We do give a great discount if you come as a team. So bring 3 to 5 people with you or more. We'll happily discount that registration for you. And then we also offer a virtual Master TeamSTEPPS course for those of you for whom travel just isn't an option. So check that out on our website as well. All right, so if you're, oh yeah, forgot, sorry, webinar. So our next webinar coming up in April, the thin blue line, drifting reliably towards a safety culture. Okay, that's a teaser for sure. Watch the website, go get more information. That's going to be a super great webinar as well coming next month. And if you are interested in speaking on one of our monthly webinars like DoTank is doing today, please check out our speaker interest form and submit your webinar proposal. We love when the field gets involved. The field loves to hear from the field. So if you're interested in possibly presenting on a webinar like this, please do fill out our speaker interest form. We'd love to hear from you. All right, quickly, because I want to get on to our webinar for today. Advisory services. We do offer from AHA Team Training, custom master trainer courses. That's anywhere from just a 2-day master trainer course to actually a comprehensive package that's 3 months or 6 months or a year long, where we will come bring master training to you, to your organization, customize that course to your unique needs and challenges. It's a super effective way to go, especially if you're looking at either an organization-wide or a system-wide implementation. So go onto our website and check that out. Okay, so without further ado, I'm going to turn the presentation over to today's presenters, Adam and Matt. They'll tell you just a little bit more information about themselves, and then we're going to get down to it. So welcome, everyone.
All right. Well, thanks very much, Rhonda. That's a great introduction, and we're really happy to be with you guys today. So my name's Matt. I'm a partner and designer with DoTank, and have been doing work with the AHA, I think, since we used to be across the street from the AHA back in the day, so since like 2016. So it's been a wonderful partnership through the years, and with TeamSTEPPS in particular, integrating human-centered design, some canvases. So really excited to be with you today, and I'm joined by our Chief Health Strategist, Adam. I'll pitch it over to you for an intro.
Awesome. Thanks, Matt. And good morning, good afternoon to everyone, depending on your time zones. We're thrilled to be here. Rhonda, thanks again for the great introduction. As Matt said, I'm Adam Kollars, Chief Health Strategist. I've been here with DoTank for about a year and a half. Prior to that, I was Assistant Vice President of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association. So just a little farther down the road for over 10 years from AHA, and had the great opportunity to discover Matt as a client back in 2015. And so a lot of the theory and methodologies that Matt is going to tee up, I had the chance to operationalize while at the State Hospital Association, and now am really just lucky to be teamed up with the DoTank team and to have us doing this all over the country. So really looking forward to engaging with you all over the course of the next hour or so. Matt's going to steer most of the ship. I'm going to be here for some color commentary, and I'm going to hawkeye the chat. So don't hesitate to ask questions or shoot your comments in there, but we're looking forward to having a good conversation with everyone today.
Awesome. So our goal today really is to share some thinking, some structure, and some tools for you guys as you're doing strategic planning. And that could be strategic planning for an enterprise, for a team. It could be planning the launch of a new process or system. So it really can scale, strategy across all different kind of dimensions, from the org to team to initiative based. So it's really focused on that. What today is not is a deep dive into TeamSTEPPS. We'll touch on it a little bit in terms of how useful it is for operationalizing and really bring your teams together to make things happen. But this is really about showing you a whole bunch of tools and stuff that hopefully some of it resonates. As you're thinking about the next initiative you need to launch or team you need to align, hopefully there's some spark of inspiration and some resources that will help you as you do it. Our fundamental approach is human-centered design, which really is what it says on the label. It's putting the people that you serve, the stakeholders, whether it's patients or your clinical colleagues or whoever it might be, at the center of the challenge. And strategy, or strategy design, we treat it kind of like a product or a service. If you want to get people on board to understand it, to have buy-in, and to really do the work, you need to create something that resonates with their experience, right? So much of this human-centered design stuff is about really understanding the cast of characters. And whether you're building something, tangible or more conceptual, like a strategic plan, it's fine-tuning it to those folks. So what we're going to share today is a way of doing strategic planning, a human-centered way. It's not the only way, but the way that we approach it is very much around engagement and getting different stakeholders, get their hands on it and to understand it while it's in the prototyping phase, and not just be the product of subject matter experts and leadership in a white tower and then saying, here's your marching orders, go, right? So we do come at this with a particular kind of, philosophical kind of approach behind it. Strategic planning is part of everything that we do, for sure. So we work on all kinds of different, parts of kind of healthcare delivery, for example, whether that's diversity and health equity, quality improvement initiatives, et cetera, right? So there's always a part of it that you need to go, that's great. We had good conversations to understand things and to make some loose decisions. But the strategic planning is, how is it going to impact end results for patients, colleagues, our partners? And how do we then move from thinking to doing? How do we operationalize things? So the strategic planning, process, if you will, is just part of everything we do. And we're going to break it down for you today into a few parts. So we think about design. So how do you, in this case, use human-centered tools and techniques to actually build the plan? Alignment is critical. You can have the most beautiful plan or document, but if you're not telling the story and actually connecting with the folks that need to do it, then you're probably not going to succeed. And then doing is, how do you move to operations? So again, design, the strategic planning process, align, what we call storytelling, and then doing. And we'll touch on how TeamSTEPPS can be helpful for that part there. We'll end with some questions and discussion, but keep them flowing in the chat. Adam will kind of field those as they come in. So I mentioned a little earlier that we think of strategic planning the same way you'd think about designing, testing, and launching a product or a service, right? So this is a high level way that, again, we approach it, and you might consider yourselves. So the kickoff and understand part is gathering the key folks and really planning what that sprint, however long your strategic planning process is going to be. You're going to want to kind of define that up front. I wouldn't recommend having a strategic planning process that's just wandering into the indefinite future. The plan itself will adapt and change over time. Of course, you want it to be a living document or output, if you will, like that's true. But in order to build it and get it going, you'll want to time box it. Time can be your friend here, right? It's always our enemy because there's not enough of it. But by staking out particular parts of it, that can really drive progress so it doesn't linger and wander. So that kickoff part, it's really important to kind of, map out the process. Designing and prototyping, as I mentioned, we treat it like a product or a service. So the prototyping mindset is, you might build a V1, get feedback, iterate it, V2, that sort of thing. So that happens in the testing phase. Refinement is about taking that input from your stakeholders and your key partners and actually, sharpening it, making it sharper and that sort of thing. And ultimately, of course, launching it. And this is Adam in my life. We were in rural Colorado earlier this week. In fact, we just got home last night. So this is actually a project working on right now with a critical access hospital to help them design their strategic plan for the organization. So here's just a specific example of how a design sprint might happen over the course of a few months. There are a few key parts to this. I mentioned defining the features. Human-centered and design often starts with the end. So start with what good looks like, obviously not the content, but the structure and the features that you need. And then you can design the interactions, the workshops, the conversations that are necessary to get there. You'll see focus groups. That's what we did in this particular case. But the idea here is you want to gather information so that you're entering the planning process well-informed. So that can be done through focus groups or surveys or interviews, conversations. Of course, gathering, market and context data from whoever your partners might be, whether it's the state association or consultants who are, or internal resource, and then ultimately building that first version. In this case, and this might resonate with some of you, when you're doing enterprise level strategic planning, you have to involve the board. So the board review is a very critical piece for us here. And by involving people, we'll talk about this more later, when you segment your audience, you've got the board and you've got your director levels, you've got the frontline folks. You want to think about how you engage in the process in different ways along the journey. So that, again, they're not just having an output dropped on their desk at the end, where after you've invested all that time in building it, it can be submarined or stopped. So involving people, the way that you build the sprint is maybe as important as the output in a way, right? Because you need to bring these people along with you. So anyway, just wanted to give you that high level view. All right. We're going to throw a lot at you here. So just take note about what resonates. And if other things don't, that's fine too. But we're going to show you some practical tools that hopefully will help you when you go forth. So designing the fundamentals for designing your strategy. So part one is think about that cast of characters that you'll need to engage in a couple of different ways. So in one sense, you'll want to gather that intel from those stakeholders in advance. I talked about that a little bit, just a few minutes ago. So these could include community-based partners, your internal colleagues, patients, vendors, whoever it might be. But by starting by gathering the insights that will help you, we'll talk about this in a little bit, create that foundation from which a strong and resonant and meaningful strategy can come. So that's the first part, is gather those stakeholders from an understand perspective, so you understand the context. The other key part is inviting the right in air quotes, but the necessary folks to the strategic planning process, right? We'll talk about this a little bit in the testing phase, but you don't necessarily just want to limit it to the people you get along with or your allies. Sometimes involving people early in the process that, hey, might not be fully aligned with you, or they're going to be a necessary partner down the road. By inviting them in earlier, you enhance the likelihood that they'll understand what's being built as it goes, and you'll dramatically increase the sense of ownership and input that they have to it. So there's kind of a strategic kind of element to this. So yes, you want to have the right folks in the room for their perspectives and their insights, but also for their buy-in and starting to build that alignment right from the very start. So a mistake sometimes groups make with the strategic planning process is they try to build that consensus and that alignment after they built the plan. So they're in sales mode saying, here's this plan. Do you want in? You should actually start building that alignment and buy-in before you even start. So that might be like clear to some folks, but a lot of folks don't do that. So think very critically about the folks. So I'll kick it over to you, Adam, before we go to the next part. Any thoughts about what you need to do before you get going and how you engage the people that are kind of around you?
Yeah, Matt, I would say that the biggest thing that we've touched on so far that we use that we try to achieve with human-centered design is that whole concept of empathy and empowering those that are closest to the process or the problem. And especially with strategic planning, too often that's a process that happens in a bit of an ivory tower vacuum of executives within an organization at a boardroom or having a sequence of meetings where they're putting together metrics and strategic action, but they're not engaging everybody around the house. And so as Matt tees up some of our concepts, I think the concepts that I would challenge you to keep in mind and to think of, are we doing this well enough? Is, are we deferring to expertise within our organization, regardless of what the topic is to solve and how far that strategic window is, or how myopic the project may be. Maybe it's a QI issue or something more short term, but the more that you can use human-centered design approaches to get a sense of empathy of your group and to bring in that knowledge and integrate it into the solution, the more that you're going to have folks that are accountable and empowered and that actually are behind the strategic initiative that usually is top down and from on high. And so when you boil it down, I think that's the simplest way that we are approaching these things differently. That adds a whole nother element of productivity and buy-in, because we're engaging everybody from Jump Street and they're a part of the architecture process all the way through. And so I think that those would be the concepts I would keep in mind, especially in this design kind of phase that you're articulating, Matt.
Awesome. Thanks, Adam. So now we're going to get into some real tools and kind of process. So one thing that we see a lot, and maybe it's natural, people get excited about, let's say you're launching a new partnership, for example, community-based partnership, and people just start doing stuff, right? But it's really important, regardless of whether it's a partnership or an enterprise level strategy, is to have a strong foundation. So we talked about that a little bit in terms of having good insights and intel, but the strong foundation piece is really understanding who you are, what's around you, and where you're going before you ever start designing future options, right? So the way that we do that, so a little bit of a digression in terms of the process, and this is just us, is we use visual design tools. So these are, we always say, simple structures to hold complex conversations. We've got a bunch of them we're going to show you here that you can all download for free. Most of these are all in the public domain. We've made some that are publicly available. So we'll post a link later so you can see where you can download them. But these tools are really helpful, especially for groups of people to focus, right? How often have we all been in a situation where if you're just in a room, even if there's a blank flip chart paper, people are kind of sitting and waiting in line to talk, right? So having some kind of structures that are focused on the different constituent parts of the strategic planning process helps you capture output and have more focused conversations. And they kind of look like this. These are very festive, energetic examples, but this is what they look like in practice. So these tools that you're going to see, you can print them at a local FedEx in black and white paper, 3 feet by 2 feet, um, for a couple of bucks, right? So they're really useful for in person. However, if for reasons of remote working or just access to folks, they can also be done remotely. So using visual tools is a really useful part of the kind of planning process. It enlivens it and it allows more people to kind of be involved because it gives that structure, right? You don't have the mess of 30 people in a room just talking about what should we do next. So it's necessary structure, focus, and it really does help with creative thinking. So there are tools like Mural, Miro, digital whiteboards that you may be familiar with that these things can be done. So again, great for in person, great for remote. So anyway, just a little bit of context because I'm going to show you some tools now. So, as I mentioned before, the strong foundation for us is who you are, what's around you, and where you're going. In other words, what's the current state, the strengths and weaknesses of your current state, business model, team, whatever it is that you're looking at. What's around you is the broader context, so that what you're operating in that will present, opportunities and threats and things that you'll need to account for in the planning process. And finally, where you're going, what's that shared vision or ambition? So if you're going to start moving to action, it's in service of what, right? So here are some tools that can help you do it. Current state, about as simple as it gets, the sailboat canvas. We use this tool all the time. And basically that boat becomes the SS oncology unit or the SS clinically integrated network or the SS Acme hospital, right? Whatever it is. And what you'll use are post-it notes, typically post-it notes and Sharpies, digital or in person, to start thinking about what's the wind in our sails. So today, what are the positive forces that are enabling us as a unit going forward? These can be in terms of the business context, competition, demographic things, the strengths of your brand, whatever it might be, pretty broad scope in terms of what you're looking at. Blockers are what's slowing you down. So whether you use a canvas or you just do 2 columns of enablers and blockers, doesn't really matter. But the point is, start with your team by looking at the current state. Because when it comes to strategic planning, what this is going to mean are those enablers will be things that you can leverage and lean into strategically going forward. And the blockers are things that you'll need to actively design for, right? So that they don't become things that submarine your, entire goals, right? So current state analysis is really important and you don't need crazy tools to do it. So there's one. Context. This is a great tool designed by pioneers in the visual kind of thinking and design space, the Grove in California. The context map. Again, you'll use post-it notes and markers, but as a team, what are you seeing, hearing, thinking, reading, right? So demographic trends, rules and regulations in terms of what's happening at the state or the federal level, the legislation that might impact the choices that you make. Competition, are there mergers and acquisitions? Are there new entrants? What's Amazon doing around health? Does that impact you? Is there new technology, et cetera, et cetera, et cetera, right? So you're using this canvas to kind of lay out what's happening in the environment around you. That again will be inputs and considerations for your strategic plan. So that's part 2, what's around you. And finally, where are you going? This, again, from the Grove, this is the tool that we like to use called the 5 Bold Steps Vision, but there are other tools for it. The main point is we recommend that you don't start building strategy until you understand who you are, what's around you, and where you're going. This helps get your team on the same page, but it also starts to pop up those things that will be elements or at least topics of conversation for your future state strategic planning. So it might seem obvious to kind of get this strong foundation, but unfortunately we see it's not considered or done very often. So there's a few tools that you might want to consider using as you go through that foundational phase. But before I move on, Adam, that strong foundation going forward for strategy, what have you seen or what would you add or any tips for the folks for this phase?
Yeah, and quickly, folks, again, feel free to just jump into the chat with stuff. We've got a couple comments we're responding to, but Matt, I think the biggest thing around strategy is just getting the more diverse perspectives and those that are closest to the process as a part of the conversation as early as possible, as I kind of said before. So it's really about just in de-siloing the process a bit and taking it away from maybe just your C-suite or maybe just some key VPs who's usually it's their job to help craft these strategy initiatives. And it still is. It's not changing that, but it's allowing a period of time and of exploration for those VPs or the C-suite folks who are going to craft this to get input from others that usually aren't a part of the process. And there's one thing you take away from this first part, I would think it would be that the more folks that you can engage earlier on, the stronger that strategic plan is going to be, and the more likely it's going to be that you're going to have strong buy-in to that plan when it's time to move to operations and away from kind of planning, but into operational mode.
Yeah, that's a great point. And just a little build on that, Adam. So when we do these things, we'll sometimes break people in groups of 4 to 6 folks. And you might have, depending on the size of your strategic plan or your enterprise, multiple groups that work on these things. What we'll often tell folks is that if we're engaging like the director level or the operators, your role is to paint in broad brush strokes and create, the raw material and the inputs for leadership to consider when they're making decisions. So when you go through this broader engagement process, it is important to set clear expectations and understanding to everyone along the way so that people aren't maybe disappointed if what comes out the other end isn't exactly what they designed and drew. So there are some kind of best practices about how you responsibly and well engage these folks. But by engaging the people, to Adam's point, they will recognize what comes out, the other side, and hopefully understand it better and be more inclined and motivated to operationalize it.
And Matt, we just got a question in the chat pertaining to this canvas, wanting to know if you can just restate the themes around the sun of the vision and what those themes represent.
Sure. So this is a kind of a loose structure. So the way that we'll facilitate this canvas is, let's say there's a group. The vision statement is the fundamental impact and change that you want to create. So it can be kind of your mission. We want to be the number one, provider of X services in Northern Illinois, whatever it might be. That's the center thing. I'd say on the vision statement in the middle, don't let people get caught in wordsmithing. That's a facilitation advice. People can get really caught in the details there. But the themes, to your question, this is adding detail to how we achieve that vision. So the themes could be a financial metric and outcome. It could be an improved clinical or quality outcome metric, right? It could be an engagement metric with patients and families. It could be a geographic expansion of a service line, right? So theme is purposefully vague in this case, but what you're going to want to fill in here is painting that picture of, if we're successful in the future, we'll have achieved what, whether it's financially, health outcomes, the different metrics that you choose. One thing that helps with this canvas in particular, as you can see, we could talk about any one of these canvases alone for 20 minutes, but it helps to put a timestamp on it. So when people are imagining the future vision, say 3, 4, 5 years down the road, rather than the indefinite future, because you do want to get to some degree of specificity. Of course, the future is wild and we have no idea what's going to happen, to paint that picture. The bold steps are the critical changes or actions you need to make as a team in an effort to achieve those objectives, those themes, in service of that vision. That's basically how this works. The supports and challenges, somewhat akin to that sailboat canvas, these are the contextual factors that are going to help you along the way or slow you down. So thank you for that question. And for all of you guys, if you have questions, we have video, I think, for this one and most of the other canvases on our Healthcare Innovation Hub that takes you through how to use them.
Another just 20-second example there for the themes that's really tangible. We were just doing service line development within the strategic plan with the hospital Matt and I've been at for the past few days. And 3 themes that came up, these different service lines very broadly, was assessment. We need to assess the market. We need to assess what services are coming in, going out. Like there was an assessment theme that we kept running into, a resourcing theme. So when we start this new service line or bring this new provider, how are we going to staff it? How are we going to manage it? And then there was an access theme around How are we going to ensure that we're communicating to our patient population that this is here, and then that they have access to these services in a way that's meets them in the right place in the right time? So assessment, resourcing, access. When you think of this, Michael, those kind of themes are ones that we challenge teams to be thinking about once you have that core vision.
All right, so you've got that strong foundation. So building the future state. Again, there could be a lot of detail in here, but we're going to go pretty high level here. Again, sticking on the theme of tools, what can you use to help you think of the future state? The business model canvas, some of you might be familiar with it on the call. It's probably the most famous design tool in this relatively small niche of human-centered design, but it's 9 building blocks of how a team or an organization, you scale it up or down, creates, delivers, and captures value. So even if you're a not-for-profit, you still have a business model, right? You still, to be sustainable, you still need to have, you inputs in terms of resourcing, you have cost structure. So I'm not going to go into the weeds of this canvas. There's plenty of resources out there to help you with it, but creating a future state business model can help you in the raw materials of building the strategy. So what do we look like in the future? Here's another example. Before I go into this, though, a little public service announcement. Maybe you guys have found yourself in this quagmire before. What's a strategy? What's a tactic? What's an objective? What's a goal? What's a measure? There's word soup in strategic planning space that some of you may be able to relate to. It's kind of slippery language, right? It's very abstract. So what I would advise to you is before you start, just align on what your language is and what your hierarchy is for your strategy. So an example is OGSM, or objectives, goals, strategies, and measures. If you want to call it objective, goals, tactics, and deliverables, that's fine. When Adam and I work in a lot of different contexts that have their own individual vocabularies, so we tend just to survive, to adapt to the vocabularies and the language of the places where we work. But whatever that vocabulary or language is, with your partners that you're working on, align on what those things are. Because man, you can get lost in just being, is that a tactic or is that a strategy? So anyway, just a little public service announcement. But here's a tool that we use for OGSM, right? To help define what fundamentally is our objective, what are goals that we need to reach in service of that objective, what are strategies that we'll employ in an effort to reach our goals, and measures / metrics are how we know we're tracking, what data should we be looking at to know that we're actually achieving the things that we need to in order to achieve those objectives and goals. So again, there's different ways to do this, but you'll want to create that structure. The metrics and accountabilities at the end. So after you get by the big picture impact objective stuff is so important. I'm sure you've heard lots of phrases, measure what matters, and things like that. Another good one is if everybody owns it, nobody owns it. So once you have the different, pillars or, the data, the parts of your strategic plan, make sure you assign a champion, a sponsor, a coach, whatever you want to call it, that's really tracking those things. That sponsor doesn't necessarily have to do all the work, but they need to keep a keen eye on it and make sure that you're progressing. Moving to action, a strategic game plan is really important. You want to move from thinking to doing. So we'll use a tool like this. It's basically just a project plan. Each chevron is a unit of time. So this could be 4 weeks, it could be 4 months, or it could be 4 quarters, right? But you'll use Post-it notes to be, Bob's going to call this person and Jane's going to do X, right? So you want to do some kind of project plan that moves the strategic thinking to the strategic doing, if you will. So that's important. And then kind of finally, what Adam and I do is we start by defining that architecture of the strategic plan up front. So I mentioned at the beginning of the webinar, you start with the end. So you design kind of the bucket or the structure that then you have to fill with content. So some strategic plans will have different features. For example, it might be important for one plan to have succession planning, right? Or it might be really important to dive into governance and something else, right? So there are particular strategy features that might be a little niche or specific to your topic outside of your standard objective, goals, strategies, measures, tactics type stuff. So up front, think about what elements will be necessary to comprehensively tell the story of your strategy going forward. And if you dig the tools and the visual stuff, there are plenty specific tools out there. So for example, these are getting released later this month. So we're working with a group called AI Priori to create a suite of strategic planning tools to help organizations design their artificial intelligence strategy, right? So there are things you need to consider around governance, bias around AI, a whole number of things that are very specific to this topic that need to be part of your strategy. So anyway, quick plug. These aren't out yet. They're coming soon. If you want to see them when they come out, just give a holler. But the point is, there's lots of kind of precision tools that help you dive into those kind of specific aspects. And then output, right? So God, you've used all these canvases. You're not going to dump a bunch of canvases on the CEO's table with Post-it notes and say, there's the plan, right? So you need to consolidate and tie this stuff together. You need to tell the story. There's lots of different ways to do this. It might be, we'll often do kind of one-page charters. So we'll do a lot of planning around very specific things. Many of you have seen the thing on the right, the common strategy house, where each pillar might be your set of goals. The top is your mission, kind of vision, the community. Foundation is your values, right? So there's lots of visual structures. We're not going to go through all of them, but they can be one pager, but ultimately it might be a 15-page deck, right? So Adam, you have a lot of experience seeing all different kinds of outputs and stories. What are your thoughts about this big topic that I flew over pretty quickly?
Yeah, I think the operative point here is, like you said, it's the process of this, of human-centered design is a lot of fun, but it's often very messy. You're getting folks either in a room with a bunch of Post-it notes around, you're ideating, and you're getting the knowledge you need, but it's usually at the end of those sessions, it's not pragmatic to take all those things and send them in an email, or to even translate what happened here into a one-pager. And so as you're thinking of strategy and human-centered design and trying to integrate some of these principles, just be very mindful of your audience and how to capture the output and the outcomes of that process into the ways that our current executive C-suite everywhere likes to get knowledge. Give me the one pager. Give me the elevator speech. So that project charter document on the left, we've reskinned it a lot for health and racial equity, for clinical practices, you name it. But the cool thing about that process is that there's about 6 canvases that once you fill those out and get what you need, populates into that one pager. So you can do the human-centered design process in a really effective way, but also bottle and kind of capture the outcomes of that and translate it to an executive team or a board or a DEI committee or a quality committee in a way that they're used to, consuming information. And so I think for me, that's the operative point here. If you're going to use human-centered design, be mindful, and visual canvases, be mindful of how you're going to translate to those folks that aren't in the room that are still important stakeholders to the process.
Awesome. Thanks, Adam. And then, so you've got your prototype, like, hey, we've built the strategic plan. The testing and the iteration of the plan is really important. This is where you'll continue to build engagement and refine the quality of your strategy. So kind of mentioned this a little bit earlier in terms of who you invite to the party, but even at this phase, with testing, this is where you can really get the plan involved with folks at different scale, right? So even if it's the C-suite, the ultimate group that may decide whether they want to resource your project, get them involved early, right? I think there's a quote I like from a guy named Kevin Kelly. It's like, ask someone for money and they give you advice. Ask them for advice and they give you money. The idea there is get them involved, get them to roll up their sleeves and try it on and try to see what it feels like. So really think about the engagement of your audience. It might be sharing your prototype and being very clear. This is still in draft form. We'll sometimes ask 4 questions. What do you like? What do you dislike? What's missing? What's confusing, right? So segment your audience and get feedback on it, test it. And like we talked about early, always invite those folks, even though it might be uncomfortable. Invite those folks that they might be hostile to the initiative, right? Or maybe you don't have the best rapport with them, whatever it might be. It might feel safe to like, oh, I want to get this thing perfect before I bring them in. actually invite them early. Okay, quick pause. We've got a survey here. So I think Kara, there it is. So we just want you to reflect personally about a change initiative because strategy involves change, right? Could be drastic, could be incremental. But think about a change that was implemented at your org recently, right? In terms of that communication and involving folks, do you feel that when that change or that strategy was launched, did people understand it? Did they understand the why behind it? So, just kind of curious, a little moment of reflection. Think about a change that happened in your org, and how well do you feel people understood it and understood the why behind it? So, we'll just take a minute to answer that. And to clarify, the answer is nearly everyone did means crystal clear. It was 90% of people got it. Story well told. Nearly everyone did not. Like, what the heck is this? Right? Why are we doing it? And then there's some gradations in between. All right. Very much, almost 50% said it was 50%. Yes and no. It was split. Wow, that data really fell on a curve there, didn't it? That's interesting.
Quite the bell curve. I
Yeah.
mean, that's it. It's literally, yeah.
Well, obviously you want to be in that mostly yes, if not nearly everyone did, but not too much to add to that. That's just interesting insight. So thanks, guys. All right, I'm going to pick up the pace a little bit here on the other slide. So that's kind of the design phase, right? Went over a lot. You can always reach out to us after if you have questions. The align piece, super important. Often not given enough love, resources, or attention here, right? People like we design the strategy, our job's done. Let's drop it on people's desk and walk off. You can't, even if you're fatigued. The storytelling phase of how you launch it and how you create experiences for people is really important. It's not enough to just distribute the PDF, right? So the link between strategy and storytelling is very strong, right? I love this quote. If the story, the coherence, the articulation of it doesn't make sense, then you should question, the integrity and the quality of the strategy that underlines it. If you can't communicate and share the story of the strategy, then you're in trouble. The strategy is the story. It's the story of the future and what we need to do to create some kind of change, right? So the storytelling is really critical. And the whole point of storytelling, people hear storytelling, entertainment by the fire. No, it's to convince people of a point of view, to acquire resources. So the art of storytelling is to try to bring people on your side. People can be very hard to persuade. They like to do things the way they've done it. They have their own personal preferences. There's a real art to changing the point of view of a human being, as we all know. And we've done whole webinars on this topic, so I'll go quick here, but we break it down into story plus telling. So in this case, the content is your strategy. Is it strong? Is it coherent? Has it been tested? Do you have good strategic content? Alignment is amongst the team that's telling the story. Are you telling the same story? Perhaps with your own inflections and nuances, of course, and personality. But are people hearing roughly the same message and they're not getting confused? The telling is really important. This is kind of the art of marketing it. The channels are how you communicate it. So that could be pinning your one pager on the cork board, at the end of the hallway. It could be having some content in a monthly newsletter, whatever it might be. In the plan is how you campaign to people over time. So how are you sharing elements of the story in different pieces and different media over time so they understand it, it stays fresh, it stays current. Again, there's a lot here, but building the great strategy is one thing. Keeping it alive and engaging people with it is another, and it's really important. The story, we'll kind of go quick here. Some fundamental elements are head, heart, eyes. So if you're building that strategic plan at the end, yes, it needs the head. It needs the data, the rationale, the market research. It needs all that, right? So it needs the data to make it feel like it's well backed and it makes sense. But it needs an emotional connection too. Why are we doing it? In service of what outcomes? How is this going to impact our community? This could be represented in some quotes or some case studies, but it needs to have that part. And finally, there is an aesthetic component, right? How is it being presented? So it could be eyes or it could be sound as well. Whatever, if you're doing a video or a voiceover recording, how are we presenting this information in a compelling way? These things are all really important. The head, heart, eyes. Again, I'm going over this very quickly, but the telling of the story, you want to consider the thing that comes out the back end of it and how you're reaching people with it. And that's what the telling is how you're reaching them. So empathize with your audience, understand the value proposition. Why should you care about this strategy and why should you be on board? You're not necessarily going to have a one size fits all story. The story around your strategy and why you should be excited is going to be different for different groups. It's going to be different for the patient or the community member or your clinical partners or that sort of thing. And again, just a reminder, the storytelling part is to help make it happen, to influence change, to mobilize your strategy. So I know we're kind of running a little behind on time here, but I do, Adam, I do want to you work in this so much. Is there anything that you would add around this storytelling phase?
The real quickly, head, heart, eyes, right? Those are the takeaway messages here to remember. I feel like in healthcare, we're amazing at the head because we work with clinicians who are data driven and they want to know the data. So we're really good at putting in graphs and, justifying why. The heart piece you do every day. Like we're an altruistic field. We do so much that we don't communicate the right way. I think the heart piece is what we do well, but we don't articulate into our story well enough. So we work with a lot of teams and saying, hey, where's the heart in this? And how do we integrate the patient story, the patient perspectives in a way that's meaningful? And then the eyes, the head, heart, the eyes is probably where we're worst off in healthcare. Our slide decks, our presentation is not helpful. And so being mindful, I think of that with your comms and marketing teams is always something that knowing that we shouldn't just put everything on PowerPoint slides that has 1,000 words on it. And so that's one where I think we can focus a little bit more on as just an industry in general is being better with the eyes and the aesthetic and integrating that heart that we do so well every day that no one sees, telling that story. So those are the only things I would add, Matt.
That's awesome. Thanks, Adam. And the storytelling segues very much into the doing, right? So as it's getting out to the folks that really need to make this strategy a reality. So just a few ideas around this doing part. And frankly, this is where TeamSTEPPS comes in beautifully, right? So you've got this great strategy that you've tested with a group of people. You've got this engagement and this buy-in. You've told the story in a few different ways over time, so people understand it. They're hopefully talking about it, socializing it. But then from day to day, how do you lead teams? What communication is necessary? Like, how do you make sure that there's support and that this strategy is alive? So that's where, I'm not going to go into great depth here on TeamSTEPPS, but that's where this can be really helpful. And if you liked the canvases we've shown you, we partnered with the HA to design day 2 of their training that has multiple design canvases. So it's been a real privilege working with them to make TeamSTEPPS even more like visual in terms of visual thinking. So there's some really cool stuff there. But ultimately, it's about influencing change. Just like this is similar to the head, heart, eyes thing, right? It's like in this case, you need to have structural, you need to have the process, then emotional connection so that people care, and the rationale so that they understand the why behind it, right? So there's so much depth that you guys will all get if you're alumni of TeamSTEPPS or you plan on taking it, but a brilliant suite of kind of tools and methodologies to make sure the team stays focused and that stuff's getting done. But then with the strategy itself, sometimes an element are values. Values are something that I've changed my opinion about over the years. I remember kind of when I first started doing this, I'd go into some places, I'm just being frank with you guys, and I'd see values on the wall. We believe in this, this, this. It's like, what are these high level container words that are stuck on the wall? Like, do people really pay attention to this? It seems like noise. Sometimes they seem kind of generic. And what does that even mean? I've come around to think that values are incredibly important when they're used and used well, of course, but just used. Sometimes they are just kind of sprayed on the wall and kind of forgotten about. But if you reference them when you make decisions, so for like, do tank, it might be one of ours is being experimental. A value doesn't just have to be a moral or ethical value. It can be about a way of working, right? So one of ours is experimental. So when we're talking to each other, it's like, we want to build a new tool or a thing that's in service of being experimental. It helps align the team around it and understand why. So the values can be really important to getting stuff done if you mobilize them and keep them alive. And then this is one of the biggest tips that I give people, just in terms of like, so let's say you're creating a strategy that's not at the enterprise level, right? It's for a department or a team or a unit or something. The C-suite's making strategic plans all the time. And a lot of times you have access to them because hopefully they've done a good job of telling you the story of that plan. Use that language and invoke it when you're building your own strategy. It's very hard for people to throw darts and shoot down something when you're invoking all the things that they've said in the past. So that's just a like kind of a little Machiavellian tactic, is be aware of the larger enterprise strategy. I mean, it's good form to be aligned with that anyway, but in the language and storytelling, use that language because it will increase the likelihood that your stuff will land. And keep your strategy alive. It's okay for things to adapt and for change. Literally bring up the document and look through it with people. Don't just forward it every couple of months. Keep it alive. Repetition is key to retention. You remind people of it. It's also key to kind of reconnecting folks with it in that commitment. So one final thing, and then we'll open up to questions. We'd love for you, because you've all been through strategic processes, use the chat. And let's say, we gave you the mic in this webinar for, a couple of minutes. What advice would you give to each other, to a peer or a colleague, to ensure that things get done effectively? Make sure you do X. It can be something similar to what we covered, in the last 50 minutes. It could be something completely different, but would just take a moment and share some advice with each other. And Adam, if you see any interesting stuff roll in,
Yeah, I will, Matt. And as they're typing in, could you slide back 3 slides to slide 54, where it's the principles of change? We had a specific question on this one around describing, on that very first principle, creating readiness for change. And from my perspective, what that is ensuring that we have a clear line of sight on the why. And why we're going to be moving in a certain direction. And so that's getting your data story together, kind of your operations and programming story, and having that value proposition to everybody around the house of why we're going to move on this thing. So ensuring that you have that buy-in, that you've communicated it correctly and had time to get feedback on that before we start to move to vision and momentum and support and transition and all of that. So I see that creating readiness for change as just the important level setting amongst the house, with as many folks as possible, so that we're all on the same page before we start to operationalize a new vision.
Yeah,
And Matt, we're getting a ton of awesome stuff that's just flying through the chat now too.
That's great. Yeah, obviously we're not going to be able to go through all of them, guys. So, but I'm glad you're able to share with each other. That's really neat. I can't wait to read them afterwards.
Oh yeah.
Incorporate your wisdom into future work. So we don't have a ton of time left here. So just a couple of minutes. Interspersed with people's comments, Adam, are there any other questions? And again, feel free to pitch these into the chat if you'd like.
A lot of good stuff around communication. Closed loops, communicate. Really good stuff here around engaging the right stakeholders in the plan. But I would say that the theme that I'm seeing so far from my scroll is communication as being the king and the key.
Yeah, absolutely. And
when that communication happens early. Yeah.
And I think to build on that, communication can be done through comms, meaning sharing stories, sending out ideas. But when we talked at the very beginning about engaging people in the design phase, creating experiences is another form of communication. Creating a safe space and time for people to share their ideas and talk with each other, that is creating and making communication possible. So when you think about communication, don't just think about the stories, which are important. We spent some time on that, but also think about the spaces that you curate and letting people share. It's a really key part.
And that communication's a two-way street, right?
Yes.
Give your folks a chance to communicate to you as well. And that's how you engage, and that's how you empower, and that's how you get the best strategy, when that's a two-way street and not a from on high, top down.
All right, guys. So there's a couple of resources. This health.dotankdo.com is our healthcare innovation hub. Everything on it's free. You end up on a mailing list that you can unsubscribe from if you want, but you can download, I think, basically all the tools except for the OGSM canvas is not there, and the AI strategy canvases, again, those are being released in the future, so those aren't there. But there's a whole bunch of stuff here and videos and tutorials. Healthcare/delivery at Do Tank Do is a site that, if you're interested, frankly, in learning more about us, it talks about our work in clinician engagement and well-being and HRO principles and quality improvement, a whole bunch of stuff. You can learn more about our work there if you're interested. And please do reach out to Adam and I. Connect with us on LinkedIn we'd love to have you as part of our network. And if you have questions or want to chat, we're here. So, Adam, any other closing thoughts before we kick it back to Rhonda?
No, thanks, Matt. I would just say the last one we just shared, the healthcare delivery at dotank2.com, it's just a digital brochure full of vignettes. So practical examples of a lot of the theory Matt teed up and then how we've operationalized them in different projects across the country. But just thank you guys so much for your engagement in the chat, and Rhonda and Kara and AHA team for the time. And we'll kick it back to you.
Sounds good. Thank you guys. Per usual, that was amazing. I can't wait for us to post it on our website so I can go back and listen all over again. I think one of my favorite things as a nurse, I've been a bedside nurse for over 30 years. And the thing that I love about Do Tank's human design canvases, for example, is they really do make it possible for the people who aren't necessarily sitting in offices, and for who these concepts, like you've been talking about on this webinar, that these concepts might be new. You make it so accessible to the people. And that's what I love. So I encourage all of you, go on Do Tank's website, follow up some of their links, get those canvases downloaded and rolling with your people, because they just make a huge difference for creating engagement with the people who are out at the center of the change. So great. Just going to let you know that we need for you to complete an evaluation form. It appears on your screen once the webinar ends, so don't worry, you don't have to go try and hunt for it. It'll pop right up for you. We really do listen to your feedback, so please do respond to that evaluation. And then just a reminder that if you want CE credit for today's webinar, and who doesn't want CE credit, make sure that you've created that Duke OneLink account and text that TUXFET to the number on the screen, and that will get you your CE credit for today. All right, I think that that's it for us today. Please don't hesitate if you have any further questions, either for AHA team training or for Matt or Adam. Please do reach out to us with the contact information that you can see on the screen there. We'd love to get back in touch with you, answer any questions you have, refer your questions on to the guys, whatever it may be. So thank you so much for being a part of our time together today. Pass it on to the people in your sphere of influence. Let them know how they can access the webinar and watch it for themselves. And we hope you have not only a great rest of your day, but a strategic, engaged, empowered year. All right, take care, everybody.